Okay, good afternoon. I'm very thankful that the Philippines would have an opportunity to share its experience in monitoring the WHO Global Code of Practice because this has given us an opportunity to collaborate with a wider variety of stakeholders and to engage them in some continuous policy dialogue, which eventually led to some interesting results for us in the Philippines. Well, I'd like to start by briefly introducing our HRH network Philippines. I understand that some of the other countries also have networks similar to ours. It's a national level policy-making body that was also created in 2006 at the same time that GUA was created. And it acts as a catalyst to harmonize policies on HRH for the government. Okay. It also follows the model of the WHO Working Lifespan Strategy. So we have technical working groups for entry that looks at the production of health workers, a technical working group for workforce that looks at retention and equitable distribution, and of course exit for managed migration. Okay. So this is just to show the membership of each of the technical working groups. Entry is headed by our Higher Education Commission. Workforce is headed by our Department of Labor and Employment, and the Exit and Re-Entry Group is of course headed by our Department of Foreign Affairs. Now the membership here is both government and non-government offices. Early in 2012, the WHO came up with a monitoring instrument to assess how the countries were implementing the Code of Practice, and I think we're all familiar with our May 31 deadline that was given to us. When we looked at the code, we saw that this could be decomposed into 5 general areas. One was policies for health professionals, recruitment, employment, and migration. Multi-sectoral thrust to sustain health workers and strengthen health systems. Migration research and information, health personnel's rights and responsibilities, and multi-sectoral recruitment and employment practices. And it's in our understanding that the code wanted to cover all of these sections. Okay. In April 2012, we started our collaboration process with the Department of Labor and Employment, the International Labor Organization, specifically the Decent Work Across Borders Project, and the World Health Organization. And the reason was that when we looked at the framework carefully, we realized that the membership of the network and all of what we thought was extensive was really not enough to take an accurate picture of how our country was faring in terms of implementing the code. So we formed a team, a planning team. In the planning process, there was a proposal to include a wider range of stakeholders, and we talked about the composition of the multi-stakeholder groups. We also developed a partnership framework wherein we defined very well the roles of each of the agencies that we would be involving. We also created a modified tool or a Philippine tool and used the National Reporting Instrument as a basis. And the reason we wanted this modification was that so that we could more or less extract the opinions, concerns, and the perspectives of stakeholders and not just have them answer the tool as is. So the methodology that we used here was not a one-time consultation, but it was a continuous policy dialogue with our stakeholders. So looking at this framework, we decided that we would of course need our network, trade unions, we involved trade unions, recruitment agencies, hospitals, both government and private, and the professional associations. Okay. So our engagement with our stakeholders actually began early in May when we met our groups individually. During our first engagement, we reoriented them on the provisions of the code. We leveled off our understandings, expectations. We acquired their commitment to engage with us in a series of policy dialogues. After that, we gave them the electronic copy of the tools, which they answered. They went home, back to their agencies. Some of them conducted consultations, some of them conducted focus group discussions. They submitted to us their outputs, which we consolidated per group, and then we called them in for a second engagement for a participatory assessment workshop, wherein we discussed in further detail the outputs for each group in the morning. In the afternoon, we took all of their outputs and we presented it to the entire body. And this is where, for the first time, the trade unions would listen to the concerns of the recruitment agencies, and recruitment agencies would listen to the concerns of the hospitals, and the process went on. After this participatory assessment workshop, we came up with a report, a draft report, that we polished and we presented again to the body for their third engagement, for their final inputs and their final decision. So this happened on May 30, and the following day at 4:30 p.m. we submitted to the WHO. Okay. Now, what were the outcomes? What were the outcomes of this engagement? Of course, there was a unified stand that the Philippines was a source country, but having this stand raised a number of concerns that there was a need for mechanisms to protect employed health workers abroad, and that there were anecdotal evidences that there were unethical recruitment practices that were happening on site. Okay? In effect, the Philippines is actually now developing mechanisms to reduce irregular migrants, specifically in Europe, and this is being headed by the Department of Foreign Affairs. Recruitment agencies are now advocating for the promotion of ethical recruitment practices. There was also an awareness that there is a need for the integrated database system to be developed, and this is not just for compliance to policy, but we realized that having the system in place can help monitor migration trends and our migrant health workers. And in effect, we acquired their commitment to help develop this system. There is also an awareness of the extent of how restrictive our Philippine policies were for entry of health workers, and relevant to this were observable contradictions in Philippine laws and policies. And because it was fortunate that we had the professional associations with us on board, they are now strengthening their support for the ASEAN Free Trade Agreement in services and its relevant initiatives. And as a matter of fact, the Philippine Medical Association just recently partnered with some subspecialty societies to work hand in hand with our Professional Regulation Commission to help develop the ASEAN Mutual Recognition Arrangement Roadmap. Okay. There are also anecdotal evidences that there are additional requirements that are being asked of Filipino workers despite mutual recognition of competency and registration. And this input actually came from recruitment agencies that they wanted to have a formal feedback mechanism to document these cases. There were reports of discrimination in promotion and compensation of Filipino workers abroad, and related to that again is the weakness in the monitoring of bilateral and multilateral agreements. There was an expressed need to strengthen the monitoring of pre-departure and pre-employment orientation, and a need to strengthen the legal monitoring mechanisms for legal instruments. They realized that there's also a need for a wider dissemination of the code. And what was unexpected here was that, of course, we realized that the researches on migration were limited to the academe, but we did not expect that recruitment agencies would want to participate in these research endeavors as well. So had this policy dialogue not taken place, we wouldn't have known that we would have potential research partners for migration. So how has this impacted the Philippines? The bilateral agreements and international action plans that we are crafting are now considering the outputs of this policy dialogue. Our meetings with foreign ministers of health for negotiations are more focused on sustaining local health systems, because this was the focus of the code. Our department, the Department of Health, is now leading in the development of an integrated database system that would help in the monitoring of migrants and migration trends. And there are plans to conduct researches on the ASEAN in relation to the mutual recognition arrangements. Okay. So what we learned from this was that the monitoring of the WHO Global Code of Practice has provided us some opportunities to engage a broader network of stakeholders in policy dialogue. For the past 5 years, we've been having policy dialogues with the HRH network, not realizing that there are other groups that have equally important inputs that could help shape our policies. We also realize that continuous policy dialogue is needed to effect fundamental change in stakeholders' perspective on ethical recruitment practices. And the government has recognized issues on recruitment practices from different stakeholder groups. So if anybody wants a copy of the full report that we had submitted to the WHO, please feel free to contact us. So thank you.
Thank you, Christine.